So quickly talk about another clinical condition today. This is what is known as Cytokine Release Syndrome, usually called CRS. Cytokine Release Syndrome, CRS. Okay, so for the Cytokine Release Syndrome, see how it looks like. Right, so it's a potential severe immune reaction. So it's caused by rapid and there's excess release of cytokines into the bloodstream. Right, so there's too much cytokines being released into the bloodstream. So what could be there? It occurs as a side effect of maybe some immunotherapies like what? The CAR T cell therapy, or maybe side effects of some monoclonal antibodies, or some certain infections that you have. Right? So causes and mechanism is it can be triggered by what? Overactivation of the immune system. So there's lead to what? A surge in pro-inflammatory cytokines. So examples of cytokines that are usually released in cytokine release syndrome is interleukin 6, interleukin 1, tissue necrosis factor alpha, interferon gamma. So it's often seen in treatments that stimulate the immune system, like the CAR T therapy, which target cancer cells. So it can also be due to some infections like sepsis, COVID-19, systemic inflammatory disease. Okay. So symptoms of cytokine release syndrome is, if it is mild, you might just have fever, weakness, muscle pain, and headache. If it's moderate, you might have a low blood pressure, rapid heartbeat, nausea. You also have difficulties breathing. Okay. So if it is severe, as there will be organ dysfunction, capillary leak syndrome, multi-organ failure, life-threatening complications. So diagnosis is just based on symptoms, right? So grade 1 we having moderate flu symptoms. Grade 2 is moderate symptoms requiring supportive care. While grade 3 is you actually need intensive care unit level. Grade 4 is what? Life-threatening, can cause some organ dysfunctions. So treatments you use what? Monoclonal antibodies like Tocilizumab, which I have spoken about pharmacology, Corticosteroids, intravenous fluid, oxygen support. Then closely monitor such a patient in intensive care units. Right.